welcome to my channel, or welcome back if you're a subscriber. I really appreciate it. And at the end of this video, if you find my thoughts provoking and you'd like to be part of my garden world and intellectual world, please hit that like button, share, and subscribe. So my goal now with the channel is not only to share garden wisdom, organic gardening, art, and other things that are healthy and productive in life, but also to start sorting out some of the problems of the world. Because there's so much focus now on information, but information is kind of useless if you can't compile truthful, logical information and then apply it towards a solution. And that being said, we're walking around my little secret garden that I created for the neighborhood kids and where I come to find peace. So I woke up this morning with a brilliant idea. Now, I'm sorry, that sounds really narcissistic. I don't want to sound too much like our president, but it's an interesting idea, and I think it's a solid idea. So we've seen with this pandemic, the people who died, and even before we saw who was going to be affected the most dramatically by the pandemic, such as the African American community and people with, quote, pre-existing conditions. I was thinking that we know that the immune system now, our immune system, it is kind of our Achilles heel of health. So we know like cancer tends to attack the body when the immune system is weakened, and many other diseases tend to affect the body when the immune system is weakened and we cannot fight off disease, basic infections and things when the immune system is depleted. And the fact is that I think that there's a huge part of the population that don't have a pre-existing condition that have incredibly weakened immune systems based on health and lifestyle choices, stress levels, and poor diet. That being said, if the immune system is so important for health and well-being, especially in regards to longevity, should we be automatically screened every year by our healthcare professionals, just like you are screened for cholesterol and other diseases or other ailments in the body? Should we be screened and have our immune systems checked on a yearly basis? This way, if they find that you have a deficiency in your immune system, then you could be guided by your healthcare professional with the steps and options to strengthen your immune system, giving you a greater chance at health, vitality, and avoiding early sickness or death. What do you think? I think it's kind of a solid idea. Okay, so preventative medicine. Wow, what a concept. I'm saying that just because preventative medicine does not exist in our country, practically doesn't exist. On a really light kind of blah, blah, blah way it does, but not like in Germany or some of your other countries where it's taken a lot more seriously. My sister, who is one of my best friends, has been suffering from renal failure for years. She's got bad kidneys. And years ago, when it first started getting bad, she called me up and she was scared and feeling incredibly pitying. And I listened to her, and then I said, well, you know, Noelle, I've healed myself so many times, and you know, you eat like crap And yes, you have this disease, but you've definitely amped it up through poor mental health management, through stress, and through eating like a typical American. So when you want to look for a solution, when you're ready to empower yourself, call me back. But I'm not the person to call for pity, because you haven't even tried yet to fix this. I know that's really harsh, but that's who I am. So she gave it a couple days and she called me back and she said yes, she wanted my help. So I did a bunch of research and we learned that there was actually a certain diet that people with kidney issues need to follow stringently. And she went on this radical diet, and guess what? Within a matter of months, they reduced her medications dramatically, and she was in a lot better condition. The fascinating thing was her doctor, of course, who was obese, ironically. You often find that your healthcare professionals are some of the least healthy people in regards to diet and exercise, ironically, would not refuse to acknowledge her accomplishment. And years later, a good decade later, guess what? Now on the National Kidney Institute's website, they have all these new parameters for what you're supposed to eat, how you're supposed to eat, what you're supposed to avoid in the way of proteins and sodiums and what have you. So that being said, preventative medicine is one of the most important medicines. And it's not folk medicine, it's physiology, it's math, it's science, and it's common sense. Now, the sad thing is, as soon as my sister did start becoming healthy again and her kidney started to improve, she totally lost sight of the long-term goal, and she did not stick with the diet, and now she's in stage 4. But, this all comes down to personal choices. Your health often comes down to personal choices. So thank you for coming to my channel. Thank you for listening. I hope you enjoyed this conversation and it was thought-provoking and empowering instead of fear-mongering. Please feel to leave comments and questions. I love to dialogue with my subscribers, and I really want you to take care of yourselves and take care of each other, because I believe our ultimate reality is there on the streets where we meet each other and how we treat each other every day. Take care.